We begin this half hour with concerns over the flu vaccine protection. Thank you for staying with us. For Action News at 5, I'm Carolyn Clifford. The flu vaccine this season appears to be a poor match. That is according to early data from the CDC. But despite the low protection, the CDC continues to recommend getting the shot. So to find out why, let's bring in our chief health editor, Dr. Partha Nandi. So nice to see you, Dr. Nandi, on this Friday.
Nice to see you, Carolyn.
All right, so how effective is the vaccine this season, in your opinion?
Yeah, so, Carolyn, it appears that this year's flu shot is really way off target, not what we want to hear. According to early data from a study of over 3,600 folks, the vaccine reduces a person's chance of getting infected, get this, by about 16%. Even the CDC says this rate is considered, quote unquote, not statistically significant. That's not what you want to hear from the CDC. Every February, health experts, as you know, Carolyn, have to predict which flu strains are likely to circulate the following season. And I can tell you it's not an easy task because the virus, as we now know with even the coronavirus, right, the flu virus also is constantly changing. And scientists have to predict on data that lags. So if they guess wrong, guess what? The vaccine will be less effective. Unfortunately, that's the case this year. The main strain has been H3N1. It's known to mutate faster, and it causes more hospitalization and death. Having said all that, it's not all doom and gloom, right? First of all, we've had another mild flu season, so that's good. The second year in a row. Cases did start to pick up in the fall, but never really took off. And that's likely because Omicron started to spread fast and furious, so more people took precautions like wearing masks and social distancing. We know that also helps the flu. I also want to stress that the flu vaccine can still protect you from severe illness. That is also an important part.
People have to remember that, yeah, because people are so leery about vaccines, Dr. Nandi. So the CDC's report underscores the need for a better flu vaccine, obviously. Do you see a universal flu vaccine in our future?
So, Carolyn, there are scientists that are working on universal vaccines, but both Pfizer and Moderna are developing a vaccine based on this mRNA technology used to create their COVID vaccines. Plus, the NIH, the National Institute of Health, along with other groups, are also working on a universal flu shot. The goal of a universal flu shot is to provide at least 75% effectiveness, right, way more than we talked about, the 16%, over a one-year period. It includes multiple subtypes of the flu, not just 3 to 4 types, what our flu vaccine currently protects against. If that happens, I think that'll be a big, big step towards getting getting rid of the flu-related illness and hospitalization and death. So I'm looking forward to that if that does happen.
Yeah, let's hope it does happen. All right, thank you so much, Dr. Nandi, as always, for your time and your medical knowledge. Have a great weekend.
You too. Thank you.
All right, watch an all-new episode of the Dr. Nandi Show this weekend. This week, the doctor is asking if we are doing enough to fix families in the midst of an addiction epidemic. You can watch it this Saturday at 2 p.m. right here on 7.